Hi there, I'm Joe Ty from Values Coach and author of the book, The Florence Prescription. And this is a special message for the nurses of the Atlanta VA Medical Center. You know, when you think about rock stars, they're the people who can get by with just one name. If I say Ali or Madonna or Clapton or Taylor, chances are you know who I'm talking about. In the history of healthcare, there's only one rock star by that definition, and that's Florence. I don't have to tell you Florence Nightingale, the lady with the lamp, for you to know who I'm talking about. So when I was looking at who are the people in history who can help us have better insights into culture in healthcare, the lady with the lamp, Florence, was first on the list. And the more I learned about that incredible woman, the more amazed I became. And of course, we all know that Florence, more than any other person, defined what it means to be a nurse. She established nursing as a legitimate, true profession. She was a guiding light for nursing education in its early days. I sort of expected to learn that. What I didn't expect was to recognize that Florence Nightingale was also, in a very real sense, the first professional hospital administrator. She defined that role. For example, she was the first person ever to calculate cost per patient day. She understood how to operate a hospital. She also, in a very real sense, was the architect of the hospital as we know it today. In a 2-year period at the Scutari Barrack Hospital, she established the first hospital housekeeping, maintenance, laundry services, the first hospital nutrition service. She established principles like triage must be on the basis of a patient's medical condition and not their rank in the military, their social status, or their religion. Back then in Victorian England, those were radical and revolutionary concepts. The military brass and the doctors fought her. They wanted to keep their status. She stood her ground and she won, establishing a very important principle. Her book, Notes on Hospitals, written shortly after that war, established the blueprint for the hospital as it was built for the next almost 100 years. I also learned this. Florence Nightingale was history's most effective ever advocate for the health care of soldiers and veterans and their families. She spent the next 50 years following the Crimean War fighting for the veterans of that war. When Thomas Edison sent a crew to record her voice as part of a project to record voices of famous people, you know what she chose to talk about? Raising money for veterans of the Crimean War that had happened almost 40 years earlier. And when Florence died, her coffin was escorted by octogenarian veterans of that war who still remembered the kindness, the empathy, the caring of the lady with the lamp. So when it came time to write the 10th anniversary edition of the Florence Prescription for this year, 2020 being the year of the nurse, I thought that would be the obvious connection. What none of us were really prepared for was the fact that we were going to have this coronavirus pandemic hit. And in many ways, the lessons of Florence Nightingale are even more important now. You know, she walked into the ultimate healthcare crisis at the Scutari Barrack Hospital. The place was filthy dirty, infection was rampant, the mortality rate exceeded 50%. She wrote a letter home and said, "This place is the kingdom of hell." And instead of throwing her hands up and saying, "Oh, healthcare crisis," that incredible woman rolled up her sleeves and went to work and defined what it means to be a nurse and established a blueprint for the hospital as we know it today, and was a ferocious advocate for the soldiers and the veterans that she cared for. And there are many lessons that we can learn from that. We can roll up our sleeves, we can go to work. And here's something that's been fascinating for me. We have a culture assessment survey that we do for hospitals, and we have recently added a new question. What has been the impact of COVID-19 on the culture of your organization? And surprisingly, positive responses have outnumbered negative more than 2 to 1. We're hearing things like, our teamwork is better, our communications are better, there's a spirit of fellowship that we didn't have before, we're being more creative and innovative. And of course there are negative comments like, we're emotionally drained, we're physically exhausted. So the answer to the question, what would Florence do, is this. She would say, number one, we have to heal some of the harm that's been done. We've got to help people with resilience to deal with the emotional challenges of this epidemic. We have to learn from what's happened. How do we make sure that we never again have a shortage of personal protective equipment if something like this, when something like this happens again? She would also tell us that we have to sustain the good, that we cannot waste this crisis by forgetting the teamwork, the leadership, the fellowship, the innovation and creativity, the proceed until apprehended kind of mindset that we've developed out of this. I want to conclude with this last comment. At Values Coach, we have worked with quite a few Veterans Administration hospitals. And here's something I've learned about the Veterans Health Administration. When I talk with nurses, with physicians, with others about the veterans they care for, more often than not, they don't talk about the veterans, they talk about my veterans, our veterans. And to me, more than any other single thing, that conveys a sense of ownership. And who deserves that kind of care, that kind of commitment, that kind of ownership more than the people who have given of themselves for the service of their country, our veterans. So I want to thank you for all that you do. I hope you enjoy the book. And if there's ever anything I can do, please feel free to reach out to us here at Values Coach.